I am really privileged to have the pleasant task of welcoming distinguished for the World Health Day celebrations at Andhra hospitals. On behalf of the Andhra hospitals, I warmly and respectfully welcome the chief guest, Hon'ble Viswabhushan Harichandan Garu. We are highly esteemed that our Honorable Viswabhushan Harichandan Garu is among us today. We are indeed grateful to the Honorable Governor Garu for graciously and readily accepting our invitation for a special cause. I would like to request Dr. Meghna, pediatric surgeon, to present the bouquet to Honorable Governor Garu. Thank you, Meghna Garu. I am very much delighted to introduce about Dr. P.V. Ramanamurthy, our beloved Managing Director for Andhra Hospitals Group and Chief Surgical Gastroenterologist, who is a man of principles, symbol of honesty, great leader, visionary, role model for all of us, philanthropist, proactive and dynamic personality. I would like to request Dr. Bhujata, neonatologist, to present the bouquet to Dr. Ramanamurthy Garu. Thank you, Bhujata Garu. Every child is a different kind of flower, and all together makes this world as a beautiful garden. With this beautiful thought, on this auspicious morning, I would like to introduce a person with commitment, ingenious, inspirator of hope, a role model who is a man inspiration to the next generation, and a renowned pediatrician, Chief of Children's Services, and Director of Andhra Hospitals, Dr. P.V. Ramarao Garu. I would like to request Dr. Pujita Garu, General Physician, to present a bouquet to Dr. Ramarao Garu. Thank you, Pujita Garu. Please give a big clap. Dr. Ramarao Garu, Dr. Sriman Narayan Garu, and Dr. Ramesh Garu. Thank you, all the dignitaries.
सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा.
My pleasure to invite our Excellency Sri Viswabhushan Harichandan, our Honorable Governor of Andhra Pradesh, as a chief guest for this event at Andhra Hospitals. Respected other dignitaries on the dais, Dr. P.V. Ramanamurthy, my beloved brother and Managing Director, Andhra Hospitals, Dr. Sriman Narayana, Senior Interventional Cardiologist, Dr. Dilip, Senior Cardiac Surgeon, Dr. Vikram, Pediatric Interventional Cardiologist, Dr. Ramesh, Cardiac Anesthetist, and Mr. Sisodia Garu, and other dignitaries on the dais. The theme of World Health Day 2022 is our health, our planet. We all need to build a world with clean air, safe water and sanitation, and healthy available food to all. Cities are livable, economies are climate resilient, focused on health and well-being. Coming to congenital heart diseases in children, there are about 10,000 children are born every year in the state of Andhra Pradesh. Our population is same as that of UK, United Kingdom population, where UK has about 95 pediatric cardiologists, 35 pediatric cardiac surgeons, whereas in our state we have only 2 centers with 2 or 3 pediatric cardiologists and 2 cardiac surgeons. So this is not enough, but we are doing our level best. We are providing high quality child and adult cardiac services in our hospital, getting referrals from all over the state and also from Telangana. Ours is the tertiary referral center for children cardiac services in Telugu states. As you all know that early diagnosis and treatment is very important. With that, we could save thousands of lives. Could save more than 95% of children suffering with heart diseases. We've been associated with superstar Mr. Mahesh Babu. He's a brand ambassador for Andhra Hospitals, and he is helping in creating awareness about health, in particular children heart diseases. We're also getting support from other foundations, Rotary Club of Vijayawada, Vasudha Foundation, Healing Little Hearts UK, Sri Venkaiah Naidu, Vice President of India's Swarna Bharat Trust, and leading cine actress Samantha Pratyusha support. With this, I would add my best wishes for this successful and fruitful event. Thanks to all the organizers. Thanks once again to our Honorable Governor of Andhra Pradesh for your presence and participation, sir. Thank you all.
We are proud to have our Honorable Governor here. The main reason we've requested him to come over here is his presence here makes all the difference for the children who have heart problems, because this will create awareness, publicity, which makes all the difference. I mean, just a couple of minutes about our journey with children. And when the state was divided, we had problems with the pediatric cardiac surgery, because not even a single cardiac surgery wasn't done in our present state of Andhra Pradesh. So we had a baby on ventilator for about 63 days, and we were like, running around nook and corner to get cardiac surgery done for that particular baby, because that baby will not survive without surgery. We thought we'll take her off the ventilator and send her for surgery to Hyderabad, but it didn't happen. So I spoke to doctors in Hyderabad, and Ramu spoke to doctors in Hyderabad, and the kind of money that need to be spent on that particular baby for surgery, there is no way they can afford. So I thought, why not we get it done here? So we brought a surgeon from Hyderabad. We got the surgery done here. I spent all the money. I spent about, overall for the ventilator and everything, I spent about 14 lakhs on that particular baby. So that baby was off ventilator 3 days after surgery and was discharged on the 5th day. That made me really so happy on that day. I said, we are going to start pediatric cardiac surgery in our unit, whatever the expenses may be. For some strange reason, majority of the children's heart diseases, it just occurs in poor. And I am unable to see, at least a handful of patients who can actually pay. So I'm proud to say, with that, with the support of Healing Little Hearts, the technical support of Healing Little Hearts, now we have done more than 2,500 heart surgeries for children. I take pride in saying that, and many people have helped us, sir. I'm sure our Honorable Governor recognized it, and with your presence here, sir, it will make a lot of difference in the awareness. All I need is you people to create the awareness, because if the surgery is delayed, there is no point in operating on a baby. When you operate on a baby in the right time, they'll have a normal life. They might live 80 years or 90 years. But if the surgery is delayed, even if you operate, they will not have a good quality of life. So with all your support, we've been doing it from our hospital. We have spent a lot of money from our pocket, but I'm quite happy to do that, and I'll continue to do that for the rest of my life. Thank you very much.
Thank you, sir, for your valuable speech. I'd like to request the noble esteemed Governor of Andhra Pradesh, Hon'ble Biswabhushan Harichandan Garu, to give valuable message on this propitious day.
Dr. P.V. Ramanamurthy, Managing Director, Andhra Hospital, Dr. P.B. Ramarao, Chief of Children's Services, Andhra Pradesh Hospital, Dr. K. Vikram, Pediatric Interventional Cardiologist, Andhra Hospital, Simmal Narayan, Senior Cardiologist, Andhra Hospital, Dr. Dilip, Senior Cardiothoracic Surgeon, Andhra Hospital, Dr. Ramesh, Cardio Anesthetist, Andhra Pradesh, Mr. R.P. Sisodia, Secretary to Governor, my dear doctors, nurses, all health workers, ladies and gentlemen. The World Health Day is celebrated on 7 April every year with an aim to draw attention to a specific health topic of concern to people all over the world. The day also marks the foundation of World Health Organization in 1948. I am happy to know that the Andhra Hospital pediatric cardiac team has successfully performed more than 2,000 pre-children heart surgeries since the past 6 years and is planning to do another 35 surgeries in the first week of April, coinciding with the World Health Week celebrations. According to a study by the Pediatric Cardiac Society of India, our country accounts for 46% of the global congenital heart diseases population. The estimated number of children born with congenital heart diseases in India is more than 2 lakhs per year. Out of these, about 1/5 are likely to have serious defect, requiring an intervention in the first year of birth itself. The pediatric cardiology is turning out to be one of the biggest health issues among children in our country. To reduce mortality and morbidity rate of children heart disease, it is necessary to focus on the comprehensive newborn and infant cardiac care. It is possible for treatment of child heart disease with early diagnosis. Frontline health workers and primary caregivers should be given proper training and sensitized to identify the problems of CSD in the children at an early stage. Pediatric cardiac treatment should be brought within the reach of every child, irrespective of their financial status, gender, caste, religion, or social and economic background. Poverty is a great barrier for successful treatment of CSD in our country. I appreciate the services provided by Andhra Hospital Vijayawada and their pediatric cardiac team for successfully performing more than 2,000 pre-children heart surgeries since the past 6 years. I feel it is necessary to establish regional pediatric cardiac centers in our state to offer treatment free of cost so that the pediatric cardiac treatment is available within the reach of the children suffering from child heart disease, particularly for the benefit of the children from economically weaker section. I thank you for giving me this opportunity to participate in today's program. Here I will definitely tell you that serving to these people is service to God. And there are so many neglected, downtrodden people of the society who are not able to avail of such treatment. But to such treatment, this is a peculiar type of treatment, I had absolutely no idea about it. That this sort of operations can be made, and without operation also, this sort of surgery can be made. I had absolutely no idea. And here I am extremely happy to see the children which have been operated and got these benefits. And as the Prime Minister then said, that you are the frontline warriors in the country during the COVID-19 pandemic. And your service cannot be forgotten by the entire country. And especially you must be very, very sympathetic for the poor and downtrodden, sympathetic for the people who have absolutely no scope to come to the hospitals. Even they are not able to take the food for every day. and those people are also, it is not possible for them to come here. Therefore, this is a novel scheme, novel attempt, and I congratulate the director, the doctors, the associates who are involved in this job, and I hope God will definitely have their blessings on you all. Thank you all.
Please give big clap to the Honorable sir. Thank you, sir, for your valuable, informative and illuminating speech on this World Health Day regarding the theme Our Planet and Our Health. Now I'd like to request Dr. P.V. Ramanamurthy garu, Dr. Ramarao garu come forward to felicitate our chief guest, Honorable Governor garu. Shield you. It's our memento. Thank you, sir. Now I'd like to request Dr. Dilip garu, cardiothoracic surgeon, for vote of thanks.
I feel honored and privileged to get the opportunity to propose a vote of thanks on this occasion of World Health Day. It is a great honor for all of us at Andhra Hospitals, Vijayawada, to have Honorable Vishwa Bhushan Harichandan garu, Governor of Andhra Pradesh, to appreciate our efforts in field of pediatric cardiology and cardiac surgery services. It is my pleasant duty to offer a sincere thanks to our respected governor for having spared his busy schedule to be with us today. Sir, you have inspired us with your address, and we will continue to look towards you for the guidance and further inspiration. Your presence and address today on this occasion of World Health Day will help increase in awareness about heart defects in children in the general public. Thank you so much, sir, to grace this occasion and made it more successful. I thank Mr. R.P. Sisodia garu, Chief Secretary to Governor, to being with us today, sir. Thank you for helping and organizing this occasion and made it more successful. And I thank Dr. Ramanamurthy sir for his rock solid support and continuous encouragement during all these years and made this organization to become a successful pediatric cardiac surgery and cardiology unit. And the man behind all this success of this pediatric cardiac services, no doubt it is Dr. Ramarao garu. His vision, his commitment and made us to reach this stage, and we would like to have his continuous support and leadership to attain the newer heights. And I thank media and supporting team for Governor, particular CSO garu, PS garu and ADC garu and all the other supporting staff who helped in organizing this event. And I thank parents of the kids who have attended here and grace this event. And I thank my all colleagues, Sriman Narayana garu, Vikram garu, Ramesh garu and all the senior faculty of Andhra Hospitals who graced this occasion and made it more memorable. Thank you very much. And I thank the senior doctors who came here all the way and graced this occasion. Thank you very much, sir.